Recently, a patient asked me, should they have shoulder surgery? And the answer to that question is contained within this video. 1 in 3 individuals experience shoulder pain during their lifetime, and it's the third most common muscle and joint problem. If you're dealing with shoulder pain, stiffness, weakness, or instability, you might be wondering, do you need surgery? What type of surgery is best? And when should you consider surgery? In this video, we're going to tackle those questions. I'll explain the differences between arthroscopy, arthroplasty, and acromioplasty. Hi, my name is Daniel Lawrence, physiotherapist, and this is an educational video, not medical advice. However, we hope it helps. Now, whether or not to have surgery is a big decision. You should make an informed choice and feel confident in the information you've been given from doctors, surgeons, and your physical therapist as well. Let's begin by looking at the 4 common shoulder problems. Your shoulder might be painful, stiff, weak, unstable, or any combination of these. Next, we'll look at each of these in more detail, starting with the painful shoulder. Now, it's generally not a good idea to rush into surgery just to try and reduce your shoulder pain. First, you need to identify the cause and type of pain. To find the cause or potential cause of pain, your clinician will often ask detailed questions, test your movement and strength, and use imaging such as X-rays, MRI scans, or ultrasound. But even with these tools, the exact cause isn't always obvious because you can't see pain on a scan. One helpful diagnostic tool that is commonly used is a targeted injection. If the pain reduces after the injection, it gives a clearer idea of which structure is responsible for the pain and whether surgery is likely to help. Also, it's important to know that not all shoulder pain is caused by damage. Sometimes your nervous system can become overly sensitive, and this kind of pain can persist even after surgery. That's why understanding what's causing the pain is so important before choosing surgery. Next, let's review the stiff shoulder. Shoulder stiffness can result from many conditions, including frozen shoulder. In some cases, surgery, such as a shoulder capsule release, can speed up your recovery and improve function earlier. That doesn't mean all stiff shoulders need surgery, but in some cases, it's worth considering sooner rather than later. Diagnosing stiffness accurately is key. Imaging or arthroscopy, which is a small camera inserted into the joint, is often used to confirm the cause. Now, let's consider a weak shoulder. Shoulder weakness can come from nerve injuries, rotator cuff tears, or other causes. Once again, it's crucial to identify the cause and whether the weakness is temporary or permanent. For significant weakness, particularly due to rotator cuff tears, the reverse shoulder arthroplasty might be considered. But this is a highly specialized procedure and should only be used with very specific cases. Misdiagnosing the cause of weakness could lead to ineffective surgery and delayed treatment. I'll explain that procedure further later in the video. Finally, we come to the unstable shoulder. Instability might be caused by muscle imbalances, structural issues in the joint, previous injury, or a combination of these. Recurrent dislocations or partial dislocations known as subluxations can limit your activity and confidence. For younger athletes or those with dominant arm instability, early surgery might be recommended, especially if it helps prevent future dislocations and protects the long-term health of the joint. Of course, this is a proactive approach and quite different from the more cautious surgical approach typically used for other shoulder conditions. So surgery is not always a last resort, and sometimes considering surgery earlier may be more beneficial. But again, identifying the cause of instability is essential before considering surgery. Let's look at that topic next. In almost all cases, non-surgical treatments, also called conservative management, are tried first for between 3 to 6 months. This usually includes physiotherapy exercises, education about the condition, injections for pain or inflammation, and alongside this you'll usually have X-rays, MRI scans, ultrasound, and possibly nerve conduction studies to clarify the diagnosis. It's important to note that if your pain isn't improving with non-surgical treatment, that doesn't automatically mean you need surgery. Instead, it means your case should be reassessed and your treatment plan reviewed. That's because the journey towards surgery is not simply linear, and it should be somewhat iterative so that you assess, treat, reassess, and then adjust the plan. This path, of course, may still lead to surgery, but it's not the automatic next step. Now, if you are thinking of having shoulder surgery, Ask yourself and your healthcare team these 4 key questions. Number 1, is there a clear structural diagnosis? Number 2, will surgery improve function? Question 3, have non-surgical treatments failed to help? And number 4, can the symptoms still be managed without surgery? If your answers to these questions are yes, no, no, and yes, then it's advisable to continue with non-surgical care. If your answer to these questions is yes, 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 and no, then surgery may be appropriate. If your answer is no, 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 and yes, you may need a second opinion and further testing. Now, in the next part of the video, I'm going to explain the types of shoulder surgery, starting with arthroscopy, which is often called keyhole surgery. This is a minimally invasive procedure where a small camera is inserted into the joint. It's used to diagnose and to treat problems like rotator cuff tears, frozen shoulder, instability, and impingement syndrome. The benefits of this approach are less pain, minimal scarring, and faster recovery. Arthroscopy often creates a window of opportunity by reducing stiffness or pain and allows rehabilitation to progress more effectively. Next, we have arthroplasty, also known as a joint replacement. This involves replacing part or all of the shoulder joint, typically for osteoarthritis. A total shoulder replacement can last 15 to 20 years. However, in younger and more active people, they may wear out the implant faster. A hemiarthroplasty is a half joint replacement. This just replaces the humeral head and is often considered in younger individuals to preserve the glenoid socket for future full replacement. And then we have a reverse shoulder arthroplasty, used for patients with irreparable rotator cuff tears and pseudoparalysis. This reverses the mechanics of the shoulder to restore movement. It's generally very effective for restoring function, but there are higher risks of complications as it is a more complex procedure, and it's usually reserved for older adults or when other options have failed. And finally, we have subacromial decompression, also known as the acromioplasty. This removes bone spurs or soft tissue causing impingement. It aims to reduce pain so rehab can become more effective. This procedure is considered controversial as some research shows there's no added benefit over physiotherapy alone. But many medical professionals believe good results are seen when patients are carefully selected. On the screen now, I'll show a summary table of the shoulder problems and matching surgical options. So you may wish to pause the video to have a quick look at this table. So before you decide on surgery, here are some things to discuss with your medical team. You want to set realistic expectations for yourself and know how long the recovery may take. It's also important to understand that some of the pain may still be there after the operation due to sensitivity in your nervous system, and this may require some further treatment after the surgical procedure. All surgeries carry risk, including infection, nerve damage, and instability. You should be fully informed of these and comfortable when you make your decision to have surgery. You also need to make sure you're ready to rehabilitate beforehand with exercises, because this can help your post-operative recovery, and your post-operative rehabilitation is a critical activity to help rebuild strength, flexibility, and function in your shoulder. Now, I hope you found this video helpful. Please share it with anybody else you know who may find it useful. You've been watching the Physio channel. My name's Daniel Lawrence, and if you haven't already, please give this video a thumbs up and subscribe for more helpful content. See you in the next video.